Hey, what's going on, everyone? I'm Ryan Balmes. Welcome to the Ryan Balmes podcast and YouTube channel, where it is my goal and intention to help clinicians and colleagues get better and enjoy the practice that they love. In this episode, episode 6, I wanted to talk about leaving no wiggle room with your plan of care. Oh my gosh, this is already sounding boring already. But I think the plan of care, when you initiate it with the initial evaluation, is key for a few reasons. I think you need to sound more definitive when you're setting your plan of care with your patient. They're looking for it. You have the leverage of being the doctorate profession. You need to start saying it with more definitive process of what that plan of care will be. Now, I mean this at the end of your initial evaluation. Oftentimes I hear new grads and students say, it'll take about 2 to 4 weeks in terms of your plan. 2 to 4 weeks, that is a huge range. And for a patient who oftentimes have never been to physical therapy before, there's going to be a lot of questions and red flags. Wait, is this going to take 2 weeks or 4 weeks? And now you can't even answer my question because our hour session is up. There's going to be a lot of questions. Your adherence to your plan of care will probably be low too, because now you left them a question of how long is this really going to take? Be more definitive in where you think or how long you think your plan of care will be. You have some guiding, principles to help you with that. Take, for example, tissue changes in terms of how tissue heals, whether it be muscle, ligament, even nerve, or open scars. There are some timelines that you could utilize to help. So take, for example, you have a hamstring strain, grade 2. Well, muscle at minimum needs at least 4 to 6 weeks. If you want to add 2 more weeks to that, make it 8 weeks to make sure that you could get some return to sport action or return to function action. There you go. This will take 8 weeks to help you achieve your plan. That is definitive, and you could use healing tissue properties to help with that. Now, let's say you're working with more of a chronic pain patient. You have some factors from your initial evaluation that could help you determine what that plan of care should be. Should it be 8 to 10 weeks? Again, I gave you the range for you to determine what that may be, but you could say definitively, this is going to take 10 weeks of treatment. Because tissue changes wise, you need at least 4 weeks or so, 4 to 6 weeks for muscle, and maybe even tack on 2-3 more weeks in terms of the education process of pain management and things like that. So you don't have to necessarily leave it a range. Now, am I saying to overestimate so then you could finish early? Not necessarily. We are doing our best guess, but you'd want to make it definitive so that the patient has an idea of like a definitive goal of in 10 weeks, this is what I'm going to do. I mean, imagine if you were going to a personal trainer or even a personal finance person and they gave you a range. You'll reach your retirement goal range in about 5 to 10 years. That's pretty broad. Or if you went to a personal trainer and they said, I'll get you results in about 2 to 4 weeks. It's really broad. When am I going to get my results, So I would recommend to be a little bit more definitive with your plan of care. Now, I understand if you have a referral from a medical doctor and they suggest this, it really depends on your relationship with the referral, whether you can deviate from that plan of care or you need to stick with it. So that is something where ultimately you'll have to make that call. If it's a referral that they want that plan of care from its dictation from the notes stuck with, then stick with it. I'll even use the referral and show it to the patient at the end and say, your doctor wants 2 to 3 times a week for 6 weeks. I would recommend 3 times a week. How does that sound to you? You could use that as a backdrop in terms of what the plan of care you'd want. Now, it may not match it. You may think you may need longer, but no, you could always do a progress report, or maybe just know that maybe the doctor had wrote that on purpose, knowing that, okay, I'm going to write 4 weeks of physical therapy because I will schedule a follow-up with them in the 5th week. So you already have a built-in progress note report built in, and then you'll determine if you need more physical therapy by then. Other times you'll get referrals that'll say, evaluate as needed or treat as needed, and the plan of care is up to you. That means then, again, as I mentioned before in the last episode, as a doctor in profession, you are going to use your know-how to give an estimate of how long this is going to take. an estimate, but still definitive in how you deliver it. So if it says evaluate and treat, and depending on what I see in terms of the clinical presentation, I will make that determination and say, with this condition, I would estimate a plan of care of 6 weeks. How does twice a week sound to you? And then go from there. And even then, the way I presented it as a question, it leaves it as a yes/no question. Yes, I could do that, or no, I can't do that. And then it even opens up the discussion for the treatment frequencies. Oddly enough, I guess regional differences exist, but here in Georgia, going 3 times a week is not really the norm or the accepted culture here in society in Georgia, or at least in the Atlanta metro area. But there are instances where I will push for 3 times a week. Let's say a Medicare patient that I know would really benefit from just some regular exercise interventions. Then I would leave it up as a question. I think you would really benefit from 3 times a week. How does that fit with your schedule? Does that sound like something that you could achieve? That's a yes or no question. And you ask it in a non-judgmental way, and you're trying to seek an answer and see if that's something that's doable, because, there's life outside your clinic walls. Sometimes it's an immediate yes, yeah, I could do that, no problem. Boom, you got yourself 3 times a week for 6 weeks. But sometimes they'll be honest with you and say, I can't do 3 times a week. Can we do twice a week? Then I would often reply back like, sure, we could do twice a week, but I will want to make sure that you're going to do your exercises outside to get at least a 3rd session at home. Does that sound okay with you? And oftentimes you get a thumbs up. So that's one way. If you're hesitant to even shoot for that 3 times a week or even the 2 times a week, leave it up to a question. But ultimately, you'll want to sound definitive with your plan of care and give a rationale as to why you think that may be helpful. Now, for those that are the 1 time a weekers, oftentimes I think from my clinical experience, functional outcome changes with a 1 time a weeker, it's going to be a little bit slower. Your touch points with them aren't as frequent. And I reserve them for those that are, 1, already regular exercisers, meaning that they exercise on a regular basis, and 2, they follow instructions pretty well. Does that mean that oftentimes are my sports patients or those that are recreational athletes, they may be 1 times a week, but depending on their condition, the severity and irritability of their tissues, 1 time a week in terms of treatment time with you, the physical therapist, may not be enough. It is possible for something to really be truly just an exercise only, volume management, education, consulting type of treatment, but that's not for everyone. There are concepts that you can achieve in an in-person session, such as talking about pain management, energy management, volume management, that you just can't get from just a once a week treatment. And as much as we'd like to think that we can just do that over email, remember, you can't bill, that's not billable time with your email correspondent with your patient. And it's tough too. It's just the notions that we know in terms of self-management of musculoskeletal injuries, it's tough to do over the phone. And at the same time, we just don't get paid for it in terms of doing it over the phone or in email. So something to consider when you deliver your plan of care. Do your best to make it definitive. Don't leave ranges because it leads more questions to the patient. So again, ask it in terms of a question. Does that sound okay with you? How does that plan sound to you? And when you get that buy-in, that'll help you get the buy-in for them to schedule out more sessions with you to make sure that they stick to their plan of care so that you could also hold them accountable and they hold themselves accountable to meet the goals that they set out to do. Again, I'm Ryan Balms with the Ryan Balms Podcast. Thank you all for listening. Like and subscribe on the YouTube channel. Leave a comment below if you have a question. And you can hit me up on Twitter at Ryan Balms PT. I think I'll put it on I probably already said it wrong. But just tweet at me if you have any questions. And again, share this video and podcast with 3 people that you think would benefit from my content. Thank you all for listening and watching. I'll catch you guys on the next one. Bye.